Okay, welcome to another Renewal podcast. Renewal vodka. Is it a vodcast? Are we vlogging?
We vlogging.
I mean, I feel like you need a GoPro so you can like hold it while you walk.
I could wear
Hi
a
guys,
GoPro.
welcome to my channel.
The suction cup just goes right there.
Update time.
All right, welcome to another vlogcast from a hidden BTS station in Bangkok. I'm here with Bom and Amanda, and we're going to discuss today, how are we phrasing it? How to know whether your choice of surgeon and hospital is certified, qualified, all that.
Yeah, how to pick the safest and most specialized or appropriate surgeon and facility. Yeah.
Okay, so what's the lead-off question?
I think the lead-off question would be, start big, start with the hospital. Like, what does JCI mean? Do I care at all what hospital I'm at? What question should you be asking about hospitals?
That's fair enough. I mean, JCI is an accreditation out of America. It's a private entity that certifies hospitals around the world based on a number of standards.
Mm-hmm. Yes.
Turns out my mother helped run JCI accreditation for Texas Children's Hospital and the Texas Medical Center, something I like to name drop. And so JCI International certifies hospitals over here. Thailand, last time I checked, has more JCI accredited hospitals than any country in Asia.
Really?
Mm-hmm.
Yeah, China
that's
was
surprising.
eking up. Yeah,
Okay.
It's something. I think it's around 60 plus now. And this doesn't just mean hospitals. There are also clinics, and there are individual pathways that are accredited. So a hospital may have an accreditation that's JCI, and it may also have a stroke pathway accreditation for specialty in stroke treatment and that kind of thing.
Okay, yeah.
So JCI accreditation is one. There are also alternative accreditations that are pretty prestigious, but only I think Bom and Kevin, and I want to say Tani is pursuing one right now as well. But basically all this means is someone from somewhere in the world has come in, followed people around, checked that the doors don't open and you can't fall out the window, and that the nurses are following protocols, and that it's clean, and given them a clean bill of health and signed off on that.
Yeah. I mean, it's always good to know that the hospital you're coming to follows strict guidelines in terms of how they're treating patients, keeping everything sanitary, safe.
Yep.
Because like most of the time, like we got the client and ask like, is that hospital international standard?
Yes.
You know, like,
Yeah.
and we can say that like it's JCI, get it.
Yeah, I always wonder, I mean, it's funny, we see so many hospitals.
Yeah.
I mean, I myself would go to hospitals here that don't have JCI accreditation because I'm looking for a specific doctor or surgein there.
Yeah.
Yeah.
Yes.
You know,
yes.
and that's does that lead into our discussion about doctors and
Yeah,
surgeons? Okay.
the next thing is your surgeon. So make sure, the most important thing is to make sure that they're board certified in plastic surgery. If you're getting plastic surgery, they should be board certified in plastic surgery for sure. And if you're not sure, let us know, because we can send you their educational backgrounds, their CV. They also are probably listed publicly, so this knowledge you need to have and should be at your fingertips.
Because they actually have the website that we can send you the link of the list of the surgeon who actually qualify to do the plastic surgery. You know, like you can see where is their practice and then what year that they start the practicing.
Yeah, absolutely.
And there are also subspecializations, like think about, I'm going to say the name wrong, Dr. Jin?
Oh, the
Oculoplastic.
yes,
Yeah.
the eye. Yeah.
So there are people who super specialize in something. And of course, again, we deal with a lot of fields. Like just yesterday we were doing gastric, and there was a board specialization in gastroenterology and of course cardiology, and then there are general surgeons. But when we're discussing plastic surgery, there are people who specialize, like her. She went and got a degree in, I want to say finished her schooling in ophthalmology.
And then
and
went in to do.
Then did plastic surgery.
Yes.
And then got board certified. And so she ends up being a specialist in only the eyes with both kinds of disciplines, right?
Yeah. And I think we've had surgeons too that did specialties in like reconstructive or cancer for breast surgery and stuff like that. Basically,
Vishnu.
Punpissamai for sure.
And
Oh,
also
yeah.
Dr. Vishnu as well.
Okay.
I think so, yeah. But anyway, the point is, if you don't know, you can ask us, or you can do some of your research online, which is really important. If you ask us for recommendation, we'll already go ahead and pick someone in the appropriate specialty. If you've done your own research, or if someone's recommending someone to you, you can let us know. But we will tell you if the surgeon that you have been recommended by a friend is actually a specialist in what you want done. Because maybe it will match, maybe it won't, and then you can decide how you feel. And then your own personal research might have you on websites like Real Self and stuff like that, reading unbiased stories from other patients about surgeons.
Which is good.
Yeah.
It's good.
Absolutely.
Just keep in mind that, we've seen way more cases than any individual usually on Real Self has seen. So their experience is very valid and you should take it into account, but you should read 80 experiences.
Yes.
Not one, and focus.
And also like some surgeon, not the type of the surgeon who market themselves. So
Yes.
like always like who is this surgeon, but like maybe the surgeons also the teaching at like the medical school or something like that, and they're not they're busy enough, so they're not really market themselves.
It's true. This may actually lead into an interesting point of how qualifications apply directly to the recommendation. Isn't it the case that you have been or are assisting someone who was looking for a neck surgery after cancer treatment? And one plastic surgeon, who's a very good board-certified plastic surgeon, said that he didn't want to do it.
Yeah.
And another one who specializes in exactly that said, fine.
Yeah, it really depends on the doctor preference as well.
Yeah, so you on your online research, you might find that we recommended a specialist, and you can't find them at all, and that's because it might be someone who doesn't want to market themselves. We also might recommend a specialist who is very popular and likes to market themselves, and you'll find a bad story, and you'll find a good story, and then you'll find a bad story, and then you'll find 10 good stories, and then you'll find a bad one, then you'll find 20 good ones. So the idea is to put together a broader picture. So look at their area of expertise, look at their education and credentials, read their personalized recommendation to you, see if that aligns with your thoughts, talk to us, and then go and read patient stories and then put it all together, and you should be able to feel comfortable.
Yeah, because we never force the client to just like book the surgery after one recommendation. If the client is not happy with that, we always like we can try to get you as much as you want and as much as you happy. Like if you want to take some time to think about it, that's okay as well. Just get back to us whenever you decided or like you are sure about getting the procedure.
Getting a second opinion is the best thing you can do. You can ask us for another opinion. We'll send it to another surgeon. We don't mind. Or you can see a surgeon in your hometown.
That's a good one.
Like you can schedule a consultation. You're not scheduling surgery. You can just schedule a consultation. And if they tell you something and then our surgeon tells you something kind of similar, then that gives you a good idea. But you might also talk to two surgeons who have two varying opinions. And in which case, hey, maybe we can get you a third opinion. Then you can decide from there.
And I think one important point to think about when you're talking about, because I'm American and I come from, the city with the largest medical center in the world. So we have access to a lot of doctors and surgeons who, in their specialties, perform a lot of procedures. And I'm also from a rural area about an hour away. So I have treatment down there. My surgeon and a doctor may not see nearly as many cases of my type.
Yep.
And so people will say, well, I'm just going to get it done here in small, medium-sized town. If you fly to Bangkok,
this is our this is the international place for plastic surgery. If you're living in a small town somewhere else, honestly, that's the bread and butter of the surgeons here. So your surgeon that's doing your breast augmentation has more experience than you can fathom. When you ask us how many surgeries they've had and they say they don't know, it's because
they do it every day.
They're doing 2 or 3 surgeries every day for maybe they've been practicing for 20 years, and after your first 1,000 or so, I think you stop counting.
It's basically how many emails I've sent. Tens of thousands.
Yeah, so many.
Because like we always have the client who compare the price here in Bangkok and back home, like they want really to get like experienced surgeon, and sometimes they say like the price is actually same at home or maybe like a little bit cheaper in Bangkok than home, but then they decided to come to Bangkok because they said like surgeon in Bangkok, they believe that surgeon in Bangkok practice this every day. They cut people my client actually said the word that they cut people open every day. So like she said like she feel more comfortable and confident to come here more than get it done at home, because they don't know how many people that the surgeon back home get this procedure done.
Yeah, and I should make clear here, they're, as far as I recall, modern plastic and reconstructive surgery, and definitely SRS, was invented in New Zealand and Australia after World War One, I think. So there are some excellent surgeons. This is not to say they're not, but evaluate both and keep in mind you're not flying to Thailand for surgery. You're flying to Bangkok, which is the home of the medical community and is a city of 12 million people and is like the largest medical tourism destination in the world. For a lot of people. And
for the all-around service. So let's say your surgery here is probably going to be cheaper at home. We know that. And if it's cheaper, but not as cheap as you want it to be. Also understand that you're getting nights in the hospital versus a clinic at home where you just go home. You're getting personalized service. You're getting a surgeon that's in the top of their field that's still just the price of an average clinic back home. So you're also getting the best of the best for a really reasonable deal.
And don't evaluate against, okay, this is another important one, check the credentials of the surgeon at home too. I don't know how many times someone has sent us a link and you know, we don't disparage their choices. We will just say, I just have no comment on that.
Yeah.
But we read it and we see, like, this is a board certified cosmetic surgeon. It's not the same thing as a board certified plastic surgeon.
I think you're more likely to scrutinize something somewhere unfamiliar.
Yes.
So even me, if I was a doctor back home, I probably didn't check them as much as I checked a doctor here.
True. Yeah.
And that's kind of a baseless
That's true.
comfort. Yeah.
So, to sum things up, in terms of choosing a surgeon, first thing to do is ask us, listen to us, don't argue, take our recommendation.
No.
No, different. Okay, what do you think?
No, it's like you can ask that and then you can ask to get the recommendation from the surgeon that you already have in mind that you want to get, but then maybe the surgeon that you would like to have maybe have a different idea, recommendation than what you want. So maybe you can ask that to have another opinion.
Sure.
Yeah.
Start with that. And you said start even, and also big, you're going to ask us about the institution.
Find out what hospital they're operating at. Find out what your surgeon specializes in. Find out if they're board certified. And then do your own personal research. Read what they write carefully because it's written just for you. And then ask for a second opinion to compare. And with all of that, you should feel comfortable and safe and happy.
Yeah, that's fair. And quick note on hospitals. There is no Samitiwid hospital.
There's many.
6 Samitiwid. Yeah, and we work with all of them. So
Yeah.
Like Bangkok hospital,
Same.
where you want to go in Phuket, Pattaya, or Bangkok.
Yep,
Yeah.
Ratchaburi. Yeah, no, they're literally a lot of the hospitals in these groups. So we understand that you know Thailand. You've been here a couple of times. I've lived here almost 13 years. As far as I understand, you were born here and have lived here quite some time. So just approach us and ask us. We're not trying to push an option on you. So just tell us, hey, I'm thinking about Samitiwid. Which one? And when we come back with something like that, just don't be surprised, you know, because we actually know the medical community really well.
Yeah, and if your opinion is, let us know what your opinion is ahead of time. Because if we do recommend a surgeon to you and it's not who you want, we're not going to push. We're not pushing anything on you. We're not pushing procedures. We're not pushing hospitals. We're not pushing surgeons. We'll give you all the information we have, but you just tell us what you want, and we'll do the best.
I don't know how many times we've just said, look, you know, what about this surgeon? So we don't work with that surgeon. Why? I really no comment, but if that's what you feel comfortable with, please go ahead.
Yeah.
And also like the surgeon who work in Phuket and in Bangkok, and sometimes like the surgeon, the client asks like, if this the same person, is it the same person? But like such as Dr. Narapon, he used to work in Phuket and now he is in Bangkok full time.
And names that sound similar.
Yeah.
Wait, this is a good point. So
Yes.
some of these doctors, you know, if you're not familiar with like Thai names, some of them look exactly the same, but one has a T instead of a K, or it's exact same name, or it's they have a nickname they go by. So just double check what you're writing out and what we're writing out. And if you read about someone, make sure it's the right surgeon. Names can sound similar.
My favorite example of that is
Pong's.
that
one.
That's another one. Yeah, that's Pongsakorn and Pongsakorn.
Pongsakorn.
Because they used to work together. Dr. Pongsakorn is Jib,
Yes.
Yeah.
and Dr. Pongsakorn is Dr. Pongsakorn.
Yes.
But only works at his aesthetic clinic in Phuket and does no major surgery.
So make sure you're
Pitch,
talking about the right
Peachhead,
person.
And Peachhead is the one that always.
Yeah.
Because we work with Dr. Peachhead with an E, Pichet, who's a board certified and very experienced plastic surgeon.
Yes.
And there's another Dr. Pitch who works at another hospital that we don't work with that facility. And there's another doctor who specializes, I believe, at SRS. Peachhead with an I.
They all the names look exactly the same. So if you're just double check. So there's just double check you're talking about.
Sometimes
the right
we
surgeon.
can send you the photo of the surgeon to like, it is the surgeon that you are looking for, because you know sometimes the client just like confused, like who is I'm looking for? Is this the same person? So like there you go, the photo of the surgeon.
Yeah.
And you can trust that we actually know.
Yes.
Yeah.
We're not confused about who these people are. We work with them regularly.
If you misspell the name or we think that you mean a different surgeon, I will write to you and say, hey, you wrote Pongsakorn instead of, I will say, did you mean? Just like Google, if you type in something, we'll say, did you mean? To make sure it's right.
We are just like
We're just like Google.
Slightly less well-funded, but otherwise, yeah.
Yeah.
Does that cover pretty much everything?
I think so.
I think
Yeah.
so.
Do your research and listen to listen to
Me.
Yeah,
The surgeon.
Listen to us. Listen to the surgeon.
Yeah.
You know, listen
to yourself.
Listen to yourself.
Yep.
Yeah, just
Have reality of expectation that what you're gonna get, and
I could go on about this one. You know, another one that gets me is this. He's great. I read that he's great, or I read that she's great. He or she may be great
Yeah.
for the thing that person had them for, but that same doctor may not prefer to do the thing that you want, or may have a
Yeah.
totally different opinion about your procedure. So great for breast, great for face, often same person.
yeah.
Sometimes this particular one thing that you want, maybe
Yeah.
that doctor doesn't agree.
Mostly this comes up when it's your friend that recommended
Yes.
this person.
Mm.
So someone you know had a really wonderful experience and successful breast augmentation with a surgeon, and you're coming to do major weight loss surgery or a facelift or rhinoplasty,
Yeah.
which is a very
Yes.
specific specialty, and you want that breast surgeon. We work with them and we love them, but if you're looking to get rhinoplasty, we're going to say, hey, we know this surgeon's great, but
Because those surgeons will tell us in the room, I prefer not to deal with
Yeah.
cases that have tip plasty, or
Yep.
I have to do this, and only if it's very simple, or if not, I will refer to this surgeon.
Mm-hmm.
So we're not trying to sell you on another surgeon.
Yeah.
We just know that the surgeon's going to say, send it to this person.
because our partner surgeon quite very straightforward for what they want to do and what they prefer, and sometimes you might got rejected because of some some complication or whatever. And also like have the client who have the tummy tucks, but then her friend asks about weight loss surgery, if this surgeon do weight loss surgery or not, but this surgeon is not doing
Yeah.
the weight loss surgery because it's different.
Yeah.
Yeah.
And by the way, Dr. Nautapon, if you ask him at Simidiway Chinatown, is the same Dr. Nautapon. If you ask him at Phuket.
oh yeah,
Yeah.
His
yes,
opinion's
he's in
not
both places
Also
at
in
once.
Bangkok hospital.
His opinion
The
is not
same.
going to change.
Yeah, absolutely. The opinion will probably stay the same.
Yep.
Yeah.
Yep.
Man, we've really talked. Is there anything else?
No,
I
I
think we
think
cover
that's
everything.
it. That's do your research and
Yeah.
make
Yeah.
sure you're comfortable with your choice.
Yeah, exactly. And we won't force anything on you. I just heard the other day, I heard in the room like, oh, yeah, I've been talking to this woman since 2016. I mean, that's literally how long these conversations
Oh,
go on
yeah,
in some
yep,
cases.
yep.
I got that.
And like,
Yeah.
there's no pressure. We're just checking
Yeah.
in, need anything, and
Like,
then eventually,
Maybe in 1 year you already asked about like 2-3 surgeon, but then if you still like do your research, take your time. Like if in 1 year things might change and then you want to get more opinion, just tell us and we will try to get you small opinion from other surgeon.
Yep. And then call at the last minute and say, I'm flying tomorrow, and can I please? No, don't do that. Okay. I think that wraps things up.
Yeah.
Thank you very much, Vaughn. Thank you very much, Amanda.
Yeah.
Thank you very much, everyone behind the camera. If you would like a recommendation, if you want information about the qualifications of a surgeon or the surgeon you're looking at
Yeah.
or the hospital you're thinking about going to, the specialties, subspecialties, if you don't know what you want and you just want someone to give you some options,
Yeah.
get in touch with us.
Because we are free.
It's a
medical.
free service, that's
Yes.
right.
And we have
You don't
a lot
have
of
to pay anything.
That's right.
we have a lot of interviews too with our partners. So if maybe you've
true.
done your research and they still don't feel like a real human being, like
Yeah.
everybody from Dr. Ranachai to Dr. Narpan to Dr. Thera, we have Charchai.
Dr. Rushapon, Dr. Piyappa,
Yeah.
it goes on and on.
We have video interviews of them, so you can listen to them. You can see their face. You can see them interact with us, and that also might bring a level of comfort
Yes,
to you.
specifically
Yeah.
on our YouTube channel, a lot of that content is uploaded question by question. So if you're wondering what Dr. Nadapon's thoughts are on a specific topic, we may have
Yeah.
him talking about that on YouTube.
Or
Oh,
if
yeah.
you still have question, you just send out an email and we will try to get the answer from the surgeon for you.
Yeah, we will talk to you on the phone also if you like.
Yeah.
I don't prefer that, but I know you get. Okay, I think that wraps it up. Info@renewal.com, REN as in Nancy, UVAL.com, or Facebook Renewal, Twitter Renewal, YouTube Renewal, Instagram
Second
Renewal.
renewal.
What is Bomb's phone number? 08. No, just kidding. All right, well, thank you very much.
Thanks.
Thank you. Bye bye.